Welcome to the podcast. I'm Jess, a family nurse practitioner and legal nurse consultant, and this is the space where healthcare, law, and real-life situations intersect. Each episode is designed to break down complex medical and legal topics in a way that's clear, accurate, and grounded in evidence, without fear, misinformation, or sensationalism. Whether you're a healthcare professional, attorney, gig worker, parent, or simply someone who wants better understanding of how medical events and legal responsibility overlap, you're in the right place. Let's get started. Hook. Picture this. You arrive for surgery after fasting all night. You followed every instruction, and then the nurse pulls you aside and says the operation has to be postponed because your INR is too high or your blood pressure is uncontrolled. The frustration, the lost work, the worry, it's avoidable in many cases. What most patients forget to ask before they leave the clinic is a single, simple question that changes everything. If one test comes back abnormal, who will call me? And what result would actually delay my surgery? Promise. In the next roughly 20 minutes, I'll walk you through 3 practical promises. 1, you'll know which pre-op tests are commonly ordered and why. 2, you'll get clear guidance on medications and supplements that commonly cause cancellations or complications. And 3, you'll have exact scripts and a short day of checklist to reduce surprise delays. I'll also point out a few red flags that usually trigger postponement, and I'll remind you when to call your provider instead of guessing. Section 1. Pre-op Basics. Who orders tests and what do they look for? Most pre-op labs and imaging are ordered by either your surgeon or the anesthesiologist, sometimes both. Typical tests include a basic metabolic panel to check electrolytes and kidney function, a complete blood count to screen for anemia or infection, coagulation testing like INR or PT for patients on blood thinners, and in some cases an ECG for people with cardiac history. Imaging such as chest X-ray or focused ultrasound is only used when indicated by symptoms or known conditions. Each result is used differently. Surgeons focus on immediate surgical risks such as infection or anemia that could increase bleeding risk, while anesthesiologists want to know about your lungs, heart rhythm, airway anatomy, and how your kidneys and electrolytes might affect medication dosing. When you get a lab order, ask why it's needed and which provider will act on abnormal results. A practical tip. If a test is ordered within 30 days of surgery, it's probably being used for clearance. If you have chronic conditions, kidney disease, heart disease, diabetes, your team may order more targeted tests. Always confirm where to get tests done, how long results typically take, and whether you need copies for your surgical team. Section 2. Medications and supplements. This is where many cancellations happen. Start by making a complete list of everything you take: prescriptions, over-the-counter meds, and supplements. Key groups to pay attention to are anticoagulants and antiplatelet agents, diabetes medications, and certain herbal supplements. If you take blood thinners like warfarin, apixaban, rivaroxaban, or clopidogrel, there's almost always a plan to stop or bridge those medications before surgery, but timing depends on the drug, your reason for anticoagulation, and the bleeding risk of the operation. Never stop blood thinners without explicit instructions from the clinician who prescribes them. For diabetes, oral medications and insulin schedules often change before surgery to avoid low or high blood sugars. Many surgeons will have you hold long-acting oral agents the day of surgery and adjust insulin dosing. Discuss this ahead of time. Herbal supplements such as fish oil, ginkgo, garlic, and high-dose vitamin E can increase bleeding and are commonly stopped 1 to 2 weeks before some procedures. Here's a concrete example to memorize. Warfarin. Your team will often check an INR within 24 to 72 hours of surgery. If it's above the target range for the procedure, your operation may be postponed. Newer anticoagulants usually require stopping 48 to 72 hours before lower bleeding risk procedures, longer for higher risk operations or with kidney dysfunction. Diabetes, a fasting morning glucose above a certain threshold, typically over 250 milligrams per deciliter, often prompts extra evaluation and possible delay until glucose is controlled. These exact numbers can vary, which is why you should get the target ranges from your team before the day of surgery. Section 3. Interpreting results, communication, and day of checklist. First, red flags that commonly trigger delays. Significantly elevated blood pressure, systolic above about 180 or diastolic above about 110 in many settings, active infection or fever, very high blood sugars, severe anemia, for example, hemoglobin under about 7 to 8 grams per deciliter, depending on the operation, and an INR above the acceptable range when anticoagulation increases bleeding risk. These thresholds are not universal, so use them as guides and confirm specifics with your team. Communication scripts, exact wording you can use. To the surgeon or scheduler, say, "I want to confirm my pre-op instructions. Which tests are you expecting? Who will review abnormal results? And what abnormal values would delay the procedure?" To the anesthesiologist or pre-op nurse, "I take these medications and supplements. Can you tell me which to stop and exactly when?" If you get a lab result you don't understand, ask, "What is the acceptable range for this result for my operation? And who will contact me if it's outside that range?" Keep these lines simple and specific. Clinicians are used to very direct questions like these. Day of checklist. A short run-through to do the morning of surgery. 1. Confirm fasting. You should not eat solid food for the time your team specified. Clear liquids may be allowed up to a certain time. Check your instructions. 2. Bring a list of current meds and the small supply of essential meds if your team told you to take them with a sip of water. 3. Bring ID, insurance card, advance directives or guardian paperwork if applicable. 4. Allergy verification. Tell the nurse any medication or latex allergies and the reaction you had. 5. Expect the surgical timeout. The team will confirm your identity, the procedure, and the site or location. Speak up if anything looks different from what you expect. 6. If you've been instructed to stop a medication, confirm who will check the relevant lab and who will call with results if there's a problem. Recap and 3 takeaways. 1. Ask early and ask specifically. Who will act on abnormal results and which values would delay surgery? 2. Make a full medication and supplement list and get explicit stop-continue timing in writing, especially for blood thinners and diabetes meds. 3. Use the day of checklist. Confirm fasting instructions, bring documentation, verify allergies, and speak up during the surgical timeout. These 3 steps reduce avoidable cancellations, lower medication errors, and help the whole team keep you safe. A final reassurance. If you have complex medical conditions, severe heart disease, advanced kidney disease, or a history of clotting or bleeding disorders, ask for a pre-op phone call with anesthesia or your surgeon a few days before the procedure so there are no surprises. If you ever feel unclear about instructions, call and ask. It's okay to be persistent. Your safety is the goal. If you found this episode helpful, please subscribe to the show so future episodes reach more people preparing for procedures. You can also download the printable checklist and additional resources at FAQ by nursejessicaconsulting.com. There's a short form you can print and bring to your pre-op appointment with the exact questions and scripts I shared today. Thank you for listening. If today's episode helped clarify a medical or legal issue, or made you think differently about how emergencies and accountability intersect, that's exactly why this podcast exists. I'm Jess, a family nurse practitioner and legal nurse consultant, and I work with attorneys, organizations, and professionals who need clear medical insight in complex cases. You can learn more or schedule a consultation at FAQbyNurseJessConsulting.com. If you found this episode valuable, please share it, subscribe, and leave a review. It helps this education reach the people who need it most. Until next time, stay informed, stay compassionate, and always put safety first.